Передаем слово нашему коллеге. Сейчас он к нам подключается.
We give the floor to Dr. Young.
И тема доклада «Космецевтическая линия ZQ».
About the ZQ Cosmeceuticals.
Клинические исследования и рекомендации по применению в клиниках эстетической медицины.
Здравствуйте.
Dr. Young, hello. We can see you on the screen. Hello.
Здравствуйте, доктор Янг.
Здравствуйте.
Да,
здравствуйте.
Рада вас приветствовать.
Доброе утро. We're very happy to welcome you. Yes, you can start the presentation now.
Okay. Okay, can you see it?
Yes, we can see it. It's okay.
Видим, мы вас видим. Все хорошо. Продолжайте.
Shall we start now?
Yes, you can start now. Yes.
Good morning, everyone. It's truly an honor to have a presentation on this academic conference of cosmetic. I'm a dermatologist of People's Hospital of Henan Province of China. I have more than 15 years working experience in skin cosmetic field. Today, I want to share my thoughts on ZQ2 clinical application research of ZQ2 series products and application recommendations in medical aesthetic clinics. And my contents conclude two parts. The first part is about introduction of energy-based aesthetic treatments. Energy-based aesthetic treatments have gradually developed into physical treatment methods based on the medical application of laser and IPL technologies. The American Society for Laser Medicine and Surgery defined the term energy-based devices. The principles mainly include the selective photothermolysis, the selective photothermolysis decomposition, the principle of photodynamic therapy, and the photomodulation mechanisms of low-level laser therapy. And fractional laser utilize an array of tiny laser beams to deliver both ablative and non-ablative treatments to target tissues, such as fractional CO2 laser therapy for scar treatment. Focused ultrasound has been used to selectively hit target tissues, such as collagen or fat within the skin, achieving skin rejuvenation. Radio-frequency technology is used to hit collagen within the skin for wrinkle reduction and skin tightening treatment. And there are several adverse reactions of energy-based aesthetic treatments: erythema, edema, and telangiectasia. Local erythema after laser surgery often occurs within 24 hours after laser surgery and is sometimes accompanied by views or local edema occurs. Post-operative erythema or edema after periorbital and perioral laser treatment. It may last slightly longer after around 48 hours. Visual dilation persists often occur after laser skin resurfacing. And jaundice, flaking, itching skin, and skin sensitivity. After laser surgery, symptoms such as dry skin, desquamation, skin itching, and instability often occur, and even from sensitive skin. provide timely skin hydration treatment, and use functional moisturizing and repairing products and local sun protection can reduce the above adverse reactions. Purpura often occurs after post-dye laser surgery. Especially, it usually occurs after laser treatment with a pulse that's shorter than 6 milliseconds. It usually lasts for 5 to 7 days and then gradually fades until it disappears. Perifollicular erythema, edema, oozing, and crusting. Erythema and edema are common after laser hair removal and usually disappear after a few hours. Bleeding and scrabbing are common after invasive laser treatments, such as laser ablation and Q surgery. It usually disappears in 3 to 10 days despite laser treatment. Pain is common during and after surgery with energy-based devices. Pain relief methods mainly include cooling and local anesthesia of the treatment area. Burns are a common complication of photoelectric therapy. Reactions and consequences of burns include erythema, blister, erosion, and scarring. The main reasons are that the energy is too high, the pulse width is too short, or the skin is not cold enough. Then blister or erosion occur. The wound must be treated immediately. Wound protection and prevention of infection are also key to reducing scarring. And the others advise reactions such as local skin induration and cutaneous nerve damage after laser surgery can be handled by specialists. And there are some post-operative complications of energy-based aesthetic treatments. The first one is hypertrophic scar. The appearance of hypertrophic scar indicates severe photoelectric damage, which is caused by injury to the dermal collagen fibers, and there may be a familial predisposition. This often results from excessive energy, inappropriate cooling methods, post-operative infection, overlapping pulses on purpura, excessive repeated treatments, and improper management. Depressed scars. Depressed scars are relatively rare and are often caused by excessively high energy levels. Excessive energy and inappropriate cooling damage the dermal collagen fibers and subcutaneous fat tissue, leading to subcutaneous tissue atrophy. Depressed scars rarely improve over time and usually require repair through injectable fillers or other treatment methods. And post-inflammatory hyperpigmentation is short for PIH. PIH is common in darker skin types. DPL and KTP lasers also have a relatively high chance of causing ablative CO2 lasers are even more likely to result in PIH. Appropriate parameter settings and techniques are crucial for preventing PIH. Hypopigmentation and loss of pigmentation. Depigmentation and hypopigmentation are less common and typically occur after treatments with Q-switched lasers and pulse dye lasers. Using relatively longer pulse durations and avoiding excessively high energy can reduce the occurrence of hypopigmentation. Improper energy used during high removal treatments can also cause depigmentation, especially in individuals with darker skin tones. Hair loss. Reduction in hair growth is less common, but can occur with Q-switched lasers, particularly with multiple eye-borne treatments using Q-switch lasers. Fulminant acne. Fulminant acne can occur in patients undergoing laser resurfacing, IPL, or photodynamic therapy. This type of fulminant acne generally has a good prognosis, with most cases resolving on their own. Infections are uncommon and can be caused by bacteria, fungi, and viruses. These typically occur 4 to 7 days post-treatment and require prompt management. The skin barrier. The skin barrier is the outermost layer of the skin, known scientifically as the stratum corneum. It serves as a protective shield that keeps harmful substances like pollutants and bacteria out of the body, while retaining moisture and essential nutrients within the skin. Key steps in the formation of NMF is the stratum corneum of the epidermis. So whether the treatment is ablative or non-ablative energy-based aesthetic treatments, appropriate basic care is essential. And I will show you my study on the function of collagen 5 in sensitive permeability barrier. And we can see the results from the left pictures. The expression of collagen 5 in the epidermis of sensitive skin was significantly lower than normal skin. And from the right pictures, we can see that the ultrastructure of sensitive skin. We can see epidermal intercellular edema, connective structure loss and fracture, and lamellar numbers decreased. And the results had been published in Skin Research Technology. So the precautions and skin barrier repairing for energy-based aesthetic treatment is very important. We can take some methods for precaution for protecting the skin barrier. The first one is moisturizing. Energy-based aesthetic treatments may damage the bare function of the skin. So we can use masks containing ceramides, hyaluronic acid, and collagen can be used for moisturizing and repairing the skin barrier function. The second is sun protection. Wear a sun hat and long sleeves. Hold an anti-UV umbrella. Avoid prolonged exposure to under daylight. And use sun cream when going out after operation. The third one is diet. After energy-based aesthetic treatments, it's important to maintain a light diet and avoid consuming photosensitive foods as well as spicy and irritating foods until healing is complete. And during the period from post-energy-based aesthetic treatments to healing, avoid scratching the treatment skin area. And we can take some methods for skin barrier repairing for energy-based aesthetic treatments. Shorter recovery time for non-exfoliative treatments compared to exfoliative treatments, and fewer and milder adverse effects such as radiofrequency treatments, ultrasound therapy, and IPL. We can use cold compress by using ice pack in a towel can be applied to the treatment area. When using ice packs, need to avoid cold injury. And we have to do some methods to prevent infection. When necessary, a thin layer of topical antibiotic ointment can be applied to the wound. And third, we can use some methods to promote healing. Various repair materials are used clinically. After surgery, spring fibroblast growth factor, epidermal growth factor, or other healing growth factors can accelerate wound healing. The principles of skin barrier repairing for exfoliative energy-based aesthetic treatments to prevent infection, promote healing, and avoid scar formation, get patients to keep good skincare habits, and take effective post-operative care. We can use cold compress. Cold compress are generally applied for 15 to 30 minutes. And antibiotic-containing ointments can prevent infections. During this stage, the combined use of growth factors can promote tissues formation, accelerate epithelial regeneration, and reduce scarring. And appropriate medical skincare products should be used within 10 days. After wound healing and within 6 months, moisturizing and sun protection are necessary. So from the consensus, we can see experts agree that post-procedure topical steroid creams can be prescribed to minimize erythema and swelling. Sunscreen lotion with a detailed instruction guide should be provided. For patients with sensitive skin, skin hydration should be given prime importance. Post-procedure barrier repair cream and sunscreens can be helpful. And at the second part, I'll show you some clinical reports of ZQ2 repairing series products after photoelectric treatment. And the first report is about efficiency analysis of repair factor essence spray on wound healing after laser treatment of hemangioma. And there are 96 patients. They were treated by long-pulsed ND-YAG laser and treated with injection water to wash the wound 2 to 3 times per day in both groups. The treatment group additionally used the repair factor essence spray after cleaning. And the results show that repair factor essence spray is a peptide product that can promote cell proliferation and epithelial regeneration It has been widely used in therapy of various wound healing. Therefore, the repair factor essence after laser treatment can reduce local inflammation, promote wound repair, shorten healing time, and reduce scar formation. So it can achieve good effects on wound healing after laser surgery of hemangioma. And the second report is about the effect of Q-switched laser combined with repair factor essence of freckles. There are 118 patients with freckles were randomly divided into treatment group and control group. And Q-switched 755 nanometer laser was used in 2 groups. Apply the ice pack for 30 minutes after operation. The treatment group additionally used repair factor essence spray on the wound twice a day. And from the results, we can see that the effective rate is more than 83%. And Q-switched laser combined with repair factor essence spray is effective in the treatment of freckles. And from the 3 cases before treatment and after treatment photos, the results can be seen clearly. And the third report is about repair factor essence on wound repair after laser therapy of nervus of aorta. There are 86 patients who got laser therapy of nervus of aorta. They were randomly divided into 2 groups. The treatment group was treated with Verter for injection and repair factor essence spray 2 to 3 times a day. The control group was treated with Verter for injection only every day. And the results show that the treatment group has shorter time of swelling, decrustation, and wound healing. The combination of laser treatment of wound with repair factor essence spray can reduce local inflammation and complications, promote wound repair, and shorten the healing time. And another spot is about the application of repair factor essence combined with whitening essence after laser operation. There are 132 patients who were clinically diagnosed with hyperpigmentation diseases. All patients were treated with cold compress for 30 minutes to reduce the side effects of the Q-switched laser treatment. Then the repair factor essence spray was used 2 to 3 times a day with gentle pat to promote the absorption. After 5 to 7 days, applied with whitening essence together after 5 minutes of using the repair factor essence spray, the treatment combined for 1 month. And the results show that the effective rate was more than 85%. The number is high. And the results also show that practice was proved that repair factor essence can speed up the skin repair, restore the skin barrier function, and reduce the pigmentation. Whitening essence can quickly restore melanin neutralize oxygen radicals, inhibit tyrosinase activity, and prevent the formation of melanin. Therefore, post-operative use of repair factor essence combined with whitening essence has a significant promotion of epidermal healing and reduction of local pigmentation. And the next report is about clinical evaluation of repairing soothing mask for wounds after laser operation. There are 28 patients with acne scar. After accepting ERYAG fractional laser treatment, the treatment group used the EGF mask for hydropathic compress immediately for 20 minutes once a day. Thereafter, for 3 days, once in every 3 days for 2 weeks, while patients in control group did not use EGF mask for hydropathic compress after ERYAG laser treatment. The ointment was used on wound surface until for both group, with sunscreen covering the whole face every day. And the results show that there were 17 cases for partial remission and 1 case for non-remission. The effective rate was 94%. The improvement rate of the patients in treatment group was greater than 90% for pain, erythema, and other symptoms. And signs after laser treatment, 3 and 7 days after laser treatment, the total effective rate was 100%. And from the pictures, we can see that EGF mask can be used for post-operative care after laser treatment, improve adverse reactions such as stabbing pain, burning sensation, tight feeling, and erythema, drying, and desquamation. It can accelerate the repair of wound surface, and it is safe and effective. It has positive effects on improving tolerance and compliance of patients after laser treatment. So, ZQ2 skin barrier repairing series product it's containing the medical S pack, repairing soothing mask, repair factor essence, skin barrier repairing gel. They are good for post-energy-based aesthetic treatments use. The medical S pack is a stereo package. So we can storage it at room temperature and use it immediately. And the repairing soothing mask, we can use for skin calming, reduce inflammation, enhance healing time of skin. We can use it once a day for 5 to 7 days. And the repair factor essence, it's containing EGF, hydrolyzed collagen, and hyaluronic acid. So it can rebuild skin barrier, promote skin metabolism. We can use it 3 to 5 times a day. And last, skin barrier repairing gel. It contains EGF, ceramide, hydrolyzed collagen, and hyaluronic acid. We can use it to repair skin barrier, relieve mild inflammation, and we can use it twice a day. So they are very effective skin barrier repair series products, and it's helpful for our good for post-energy-based aesthetic treatments for our clinical use. That's all. Thank you.
Что я хотела вам рассказать. Большое спасибо.
Спасибо за...
Доктор Янг,
Доктор Янг, спасибо вам большое. Мы очень благодарны, что вы поделились с нами своим международным опытом и своими исследованиями. Для нас доказательная база очень важна, потому что у нас доктора опытные, все работают с аппаратными, сложными, повреждающими методиками. И у нас есть вопрос к вам. Скажите, пожалуйста, как долго вы рекомендуете использовать пациентам после лазерных шлифовок, если это, допустим, абляционные шлифовки, спрей и барьер-гель?
How long should they use spray and gel after ablative laser resurfacing?
Spray and gel, it's a different type of our products. After the energy-based aesthetic treatment, I think appropriate basic care is essential. It can including maintaining hydration, applying sunscreen, healthy diet, avoiding scratching the treated area, and do not swimming, do physical activities. So it's different for non-exfoliative treatments and exfoliative treatments. So we can use the Q2 repair series products in combining with conventional topical medications to promote wound healing and reduce complication from the project. So I think after treatment, the continuous use of the Q2 repair series products is recommended until the skin is completely healed. And a healthy skin barrier helps to retain moisture, prevent internal water loss, and protect against external irritants. Even after the skin has healed, the repair series products can be used as daily skin care to help restore the skin barrier and maintain healthy skin.
Здоровья кожи.
Спасибо большое. И еще один важный вопрос.
And also there is another question.
Сейчас у нас все больше пластических операций связано с телом. Это абдоминопластики, липосакции. Они проходят у нас, их проводят и в летний период. И компрессионное белье часто нарушает кожный покров, не дает достаточно хорошо заживать тканям. И носить его нужно долго. И мы встречаемся с пролежнями от компрессионного белья, плохим заживлением именно когда повреждается кожа, и даже иногда фибрин в ранах появляется. Можно ли использовать спрей в этих случаях? Ну, помимо еще топических средств, которые назначает хирург, можем ли мы использовать еще и спрей в этих случаях?
Can we also add spray for such wounds? Wounds after compression garments after plastic surgery?
I think for the wound healing, we can use the skin barrier repair series products. For example, the repair factor essence and the skin barrier repairing gel, because it has EGF and ceramide hydrolyzed collagen and hyaluronic acid. It can relieve mild inflammation, so we can use it for the repair factor essence. We can use it 3 to 5 times a day, and the repairing gel, we can use it twice a day. I think it can be useful for us.
Можно использовать, да, даже в случае таких пролежней из-за ношения компрессионного белья.
Спасибо большое. И еще один вопрос. Это хочу я вам задать. Скажите, пожалуйста, с игольчатым РФ, опыт применения с игольчатым РФ, ведение такое же, как после лазерных шлифовок, также используете спрей и барьер, гель.
And do you use the same products for repair after RF needling procedure?
Pardon? For what?
Do you know the radio frequency microneedling? Do you use microneedling with radio frequency? Needling with needles?
I see the needles. Yes.
Radio frequency needles, yeah? After that procedure, do you use spray or gel? How do you use them?
Spray, I think the days, the 7 days after, the first 7 days after the treatment from the radio frequency needles, we can use the spray, because there are some erythema, edema, so the spray is comfortable. And after that, after the 1 week, we can use skin barrier repairing gel, because the gel has some repairing factors, for example, EGF and hydrolyze the collagen and so on. The factors can repair our skin barrier and relieve the inflammation. So I think the 2 products can be used as this way.
Игольчатого РФ. Сначала спрей, потом гель.
Спасибо. Очень было информативно.
Thank you very much. That was a very informative presentation. Thank you. Very good presentation. A lot of information. Very useful.
Спасибо, доктор Янг. Мы можем, наверное, уже можем попрощаться с вами, но мы будем рады быть с вами на связи и обмениваться опытом. Для наших врачей это важно очень.
Thank you for joining our conference.
Для вновь.
Спасибо большое вам. Спасибо.
Спасибо. Для вновь тех, кто к нам подключился, еще раз напоминаю о том, что у нас сегодня будет розыгрыш призов самых активных участников наших дискуссий. Соответственно, мы будем поощрять либо атласом, либо наборами, в которые входит и Cosmeceutical ZQ, и Cosmeceutical Tioxan, а также 3 БАДа, Veravel, Формула-1 и, соответственно, Beauty Omega. У нас сейчас будет небольшая рекламная пауза, и после рекламной паузы к нам присоединится Голуб Анна Петровна.